Welcome back to History Foundations. We are always talking about principles, and we know that principle is a law or a state that governs action, that governs phenomenon. So let's start with a quotation about principles from the old doc to get us started. Principles to an osteopath means a perfect plan and a specification to build and form a house, an engine, a man, a world, or anything for an object or purpose. To comprehend this engine of life for man, which is so constructed with all conveniences for which it was made, it is necessary to constantly keep the plan and specification before the mind and in the mind to such a degree that there is no lack of knowledge of the bearings and uses of all parts. So I want you to just pause here in a moment and think about what he means by principle in the context of osteopathic treatment. When he says principle, he says it means a perfect plan and specification. But what is that perfect plan and specification when we're talking about the practice of osteopathy? So just pause and think about that for a second. And so you might have considered many things that could connote this idea of a plan or a spec or a blueprint. I mean, now we might say it's DNA, we might say something else. But when you think of what he's talking about, of course, which DNA might be included in, what we're talking about is structure. And when we're talking about structure in the human body, we have a word for that, which is, of course, anatomy. So that what he's saying here is that the law or the state or the mechanism which guides the form and function of a human being or a world or an engine of life or anything else that has a purpose, what we're talking about is anatomy. We're talking about form. And that in order to understand this mechanism, which, and this is the point which is kind of buried right in the middle here, which is constructed with all conveniences for which it was made, which means that it contains everything that it actually needs within it. It is self-sufficient. We must keep the form, the anatomy, the specs, the blueprint in our minds constantly, so that there's no lack of knowledge of the form and function of all its parts. And this is such a wonderful paragraph because it is so dense, it is so wonderfully dense with meaning, so compact, such an efficient way to express what the fundamental principle of osteopathy is. So there was a quote from Thomas Sowell who I thought just resonated so clearly with Still's ethos and his sort of way of being. It's something about ideas and action. And what he says is that people who pride themselves on having ideas often fail to understand that only after ideas have been filtered through real world experience do we know whether they are right or wrong. Most turn out to be wrong. So this is interesting because Still referred to himself as a philosopher, as a student of philosophy, both ancient and modern. Now, when we think about philosophy, we might have this idea, some of us, through university, that, philosophy is about theory, that it's about creating a series of definitions or categories related to concepts. Really, philosophy comes from two words, philos and sophia, which means love of wisdom. And of course, that wisdom can be informed by real world experience. So when you see Still and he describes himself as a student of philosophy, we're talking applied or praxis, right? Where theory and application meet, where knowledge and craft actually meet. Missouri was known as the show me state, i.e., Who cares about your highfalutin theories? Who cares about your words? I want to know, does it work? And when I read this quotation by Sowell, I thought, that's exactly, it's so Stillian. He was never content to just have a pet theory, an armchair theory, or be an armchair or theoretical osteopath. He was constantly testing his ideas out to see if they worked in reality. So in that way, very much a scientist as well. We're going to talk about philosophy in this class, and so I thought we'd just do a very, very brief primer on the branches of philosophy so that we understand what Still meant when he said, I consider myself a student of philosophy. Of course, we have these metaphysical questions about, the nature of the world or truth or what exists. We have questions about epistemology, i.e., how do we know what we know? If you think of that turkey and the pig story I shared with you on the blackboard drawing that Still did in anatomy class, this was a quintessential lesson, a brilliant, veiled quintessential lesson in epistemology, i.e. the question being, how do we know what we know? Upon what evidence do we base our beliefs? The book says it's something. Another expert says that this pathology or disease is another thing, but you need to look with your own senses, according to the principles of osteopathy, which we know what those are, in order to determine what to do with the case. Logic, constantly logic, what is correct reasoning? Many of the stories I shared with you last time had to do with Still applying logic, whether it was the rule of the artery, replacing the arterial force with the makeshift irrigation system to flush the shrapnel out of the soldier's thigh. Any of the other applications of his reasoning became very, very clear because he tested them out. Aesthetics, what makes things beautiful? Now, I'd say that perhaps this branch Still was less concerned with. But I would say, as a kind of an addendum, that there is a kind of aesthetic standard that osteopathic treatment needs to have in order for it to be accepted by the body, in order for the senses of the person to be able to accept the treatment. It should be rhythmic. You should understand how to engage the tissues with the right amount of force to yield and affect change. This is a kind of aesthetic thing. So I would just say as a kind of addendum that there is an aesthetic quality that treatment needs to have in order for it to be appealing to the nervous system. Now, when you look at Still's sort of hierarchy, what you'll see is that he puts ethics, I think, at the foundation of everything. And in many of the stories that I share with you, he has an idea of ethics, about what is the right thing to do? How do I enact my values in the world through what I choose to do? Constantly, what is the right thing to do? To do service for his fellow human being is always at the foundation of the stories that we're sharing. Metaphysics, this question about what is real, what is the lesion, what is the problem, the question of how do I know what I know, how do I investigate, and that logic, applied reason, becomes the fulcrum and the lever that he's able to deliver treatment and to conduct essentially the science that he is working on in application, not in theory. Now, we can look at another principle here from the Hippocratic Oath, a version of which I'm sure you will all swear upon your graduation. The osteopathic oath is a version of that. But this idea that, doctors are sworn to first do no harm. Now, this might be somewhat contentious when you think of heroic medicine and the stories shared about the kind of cures, I say in scare quotes, that were evidence of a very unscientific process, right? That we're essentially throwing things at the wall and seeing if they stick, and if the patient survives, it must have been the treatment. Consider that oath, first do no harm, when we look at the consequences of the Civil War. So we're picking up this story right now chronologically in 1865. Still had come back from the war, and within a 8 or 9 year period, we have a whole bunch of change before, as he says, flying to the breeze the banner of osteopathy. And so we'll get to that story then in a second. But let's just take a look at America at this point in time through this very helpful infographic to really look and consider about the amount of the population that had died in this war. There were so many civilian casualties, as we understand, because of the ways that ideas became mobilized. It's like as if 6 million Americans died today. 2% of the population. When you think about that for a second, that is a non-trivial amount of people. They talk about the fatality rates, of course, the causes of death. Often they would die from disease, right? 2/3 of the soldiers died from disease as a consequence of battle. Most notably, dehydration from diarrhea. That was the highest percentage of disease. So we're seeing a country that has been ravaged by this war, a war that they believed wouldn't last longer than a few months, a war they believed was quoted as saying that all the blood would probably be cleaned up by a handkerchief. They were blindsided by how long this war would last and the consequences of it. So this war lasted 4 years, and that's not even if you count Bleeding Kansas, the Wakarusa War, the border conflicts that happened in advance of it regarding the new contested territories. Many people are dead, and a lot of the rest are either suffering degrees of injury, PTSD, although we don't have the word for that at this point in time, or they're addicts, they're morphine addicts. One of Still's brothers, Ed, was actually an addict after the war and still helped to nurse him through that addiction. So you're giving you an idea of this country that is now almost bankrupt, the morale of the population. And I'm trying to kind of set a stage in which there's various people who are not really happy with the consequences of the Civil War for a lot of different socioeconomic and political reasons. So all this to say, it's not a particularly hospitable environment for new ideas. People are trying to get back to normal in a way. So it's important you understand that as part of the environment that the osteopathic concept is dealing with at this point in time. So we have this idea, first do no harm, one of the oldest kind of tenets of medicine. But we have a larger question that's really about healing. And much of this description, I will tip my hat to John Lewis, if you've heard him, osteopathic historian, author of Andrew Taylor Still, From the Dry Bones of the Living Man. But a lot of, I'm standing on the shoulders of giants in a way here, but a lot of these kind of discussions are really leaning on the work that he's done to help to clarify. So I just want to give credit where credit is due here. But this question of whether nature or physician is doing the healing is something that we need to come to terms with in medical philosophy, especially at this point in time, and to understand where osteopathy sits. So we'll do just a very, very brief survey here. Of course, we have Hippocrates, right, the first doctor in ancient Greece. This idea of the Hippocratic Oath comes from him. The four humors were what they talked about at that point in time, that the fluids of the body contained life. And in a way, we had to, when we had imbalances of fluids, they led to different temperaments, whether it was sanguine, overly happy or okay with things, choleric, mad, melancholy, phlegmatic, disagreeable or sad, that the fluids of the body were the life or the components that led to different sorts of dispositions. This is obviously a kind of pre-psychological explanation of people's health. But Hippocrates' fundamental belief was that medicine is not really doing the curing, but is aiding the healing power of nature to restore balance. So in a way, you could understand that this is in some way aligned with the osteopathic concept as well. As they say, the engine of life, a human being, which is constructed with all the conveniences for which it was made, or in a way, as Still would call it, the inner pharmacopoeia, right? This belief that the power of nature is within us, and that by finding ways to liberate the forces or the healing power of life, we restore balance to the system. Now, that is very different than what the Romans thought. Galen was considered the first anatomist, but interestingly enough, he never actually dissected a human being. Why? Because in ancient Rome, the soul and the body was sacrosanct because the soul resided in the physical body after death. That was one of the fundamental beliefs. So he dissected pigs and monkeys and probably other animals that had been fatted for slaughter. He made a fundamental error in what he observed in dead tissue. He believed, because he saw this congestion of venous blood, or the dark blood, in the liver, that the liver must be the organ that produced that blood. So he made a very, very kind of basic association or causation between what he observed in a dead animal, thinking that that must be the case in a living being. And because he saw the heart full of that brighter red blood, that it must be the heart is the place that actually creates the arterial blood, produces that blood. So it was a sort of rudimentary understanding of physiology based on what he observed in dead animals. It's like saying, telephone poles and trees are both the same because they're made of wood, right? It's a very, very simple kind of syllogism or false syllogism that he's creating, an if-then, which is not really natural to the way that the forces are observed in nature. So this led to this belief that this unnatural accumulation of various humors in blood needed to be corrected by a skillful physician, i.e. bloodletting. And of course, once again, this was a style of heroic medicine, because if you did not survive the bloodletting, you were not a strong enough Roman citizen to serve the empire, right? So we weren't working on upbuilding constitutions of people who might be more sensitive. We were, at this point in time in ancient Rome, simply through a form of selection, weeding out people who were not robust enough. And once again, it led to the same false syllogism, which is if-then. If the patient survives the treatment, it must have been the treatment that facilitated their health, right? So this is very, very simplistic. Now, this idea of bloodletting persists for another, I guess you could say, 1,500 years, that even by 18th century America, this idea of bloodletting was still around. And Benjamin Rush, who was, funnily enough, one of the founding fathers, his name is on the Declaration of Independence, believed that this morbid hyperexcitement, this hyperactivity of blood vessels, which was caused by too much blood, needed to be solved by getting the fluids out of the body, meaning bloodletting, purgatives, and laxatives. So anything that would have an emetic effect that would make you vomit or void was somehow balancing the fluids in the body. And because if the patient survived, it must have been the treatment. So this is not scientific in any way at all. It is observational. It is associational. We're looking at correlations between certain things. We do not understand a mechanism when we just throw things at the wall and then create a very simple single factorial causation. Not scientific at all. So when we see osteopathy and when we see homeopathy, even eclecticism, some of these other movements you might have heard about in the 18th and 19th centuries, we understand they are responses to heroic medicine. They are responses to conventional medicine at this point in time. And it's worth mentioning that because Benjamin Rush was a founding father and his name was on the Declaration of Independence, some people who spoke out about the unnatural or garrulous medical practices, people like Benjamin Franklin, they never directly called him out because he was a founding father and he was a doctor. So, what you see around this time is an essential divide in the 19th century between those factions of the older order who saw that life originated in the fluids, or believed that life originated in the fluids of the body. You could think of this as like humoralism, or based on the theory of the humors, versus solidism, meaning that now that we begin to have biconvex lenses and microscopes, x-rays aren't around quite yet. X-rays aren't around really towards the end of the 19th century, certainly by around 1890 or so, 1880, something like that. We have now ways to look more closely at the solid parts. So you have this idea of humoralism and solidism, that perhaps the parts that we can look at under the microscope and we can see the nervous system. We can see cells now. We can understand more about the brain. And what I think is really fascinating about osteopathy is that what you see is that there's a merging of these two views that is neither one or the other, but the relationship between them that allows life to flourish. The environment, the milieu of the cell has as much to do as any component of the cell itself. If it didn't live in fluid, if it didn't live in extracellular fluid, there would be no nourishment to happen. And, I'll talk more about the sort of origin of those ideas and the basis that we get to that knowledge from in a moment. But right now, what we're going to kind of get into proper is what's happening in those 9 years between the end of the Civil War and between Still's day when he proclaims the osteopathic concept, in retrospect, of course. As he says, he flung to the breeze the banner of osteopathy that day, June 22nd, 1874. So what is he doing? Well, we know his first family, many members of his first family died after getting meningitis. His first wife, Mary, died in childbirth. He married another woman named Mary, and he's started a new family. He's living in Kansas. He's working as a doctor just as he was, still prescribing drugs, still doing it the way he had been doing it. His first son is born in 1865. Two more sons, twins, Harry and Herman, are born afterwards. His father dies, and he's just making ends meet, trying to apply his logic to all kinds of different things. We know that this seed of doubt has been planted in his mind by General Abbott. He's asking questions, deep questions about the nature of health and disease. Those quotations I shared with you last time. He's applying his logic to invention as well. He invents something very much like the safety pin. Of course, he never patented it. A railroad switch that would allow trains to change tracks. And I love this one, a butter churn that could churn buttermilk to butter in 10 minutes. Now, this is amazing. Again, never patented. If you've ever been to a pioneer village, you always take the kids because they're going to churn butter and it's going to take all morning, and then they'll be, tired out enough not to misbehave in the afternoon. But the reason I share this story about the butter churn that he won some prize for at the state fair is because what it demonstrates is his approach to problems as a first principles thinker. And I say this because rather than trying to redesign someone else's butter churn, what he did was study the structure of milk, of buttermilk particularly. And he learned everything he could about the structure, the form, the anatomy of the colloids in milk. And because, it's very much like a cell in a way. There's a kind of lipid bilayer around the protein center of the casein that's in the middle. If the songs with curds and whey, the separation of the milk into these various, constituents that, what he thought was that if there's a way to break down the sort of cell layer, the lipid layer around the protein, then I should be able to create the emulsion in order to make the butter. And so he then invented a device that was able to do that efficiently. And this is a first principles way to think about it, to get back to what is the law, the state. How can I understand the fundamental elements of the mechanism that is this structure? Then I can figure out how can I most efficiently get to solving the problem. This is what he does in osteopathy as well. And he constantly says, man is a machine. Now, what he means by that needs some context, because we don't mean like machine, like a robot to do simple work or something like that, but very much in the way of, you could use that word machine the way that Archimedes did, simple machines. These are the examples of Archimedes' 6 simple machines. And we know he was a student of history, a student of philosophy, as he said in his own words. And so here we have all these simple machines that serve one purpose. They have different mechanisms, but they have different principles, you could say, but they serve the same function, which is, of course, to reduce the amount of effort required to deal with loads. So when you see the body like this, there's an incredible wisdom in it. You could look at each one of these simple machines and you could easily relate it to different parts of the body. To think about the way that muscles cross joints, for example, has a pulley-like function. It's not exactly like a pulley, but a pulley-like function. Or the way that wedges deal with effort and load in various structures that are wedge-shaped, right? Like the sacrum or the talus or something like that. You could think of the screw force as the way linear or rotational force is translated into linear force through ligamentous attachments of the coxofemoral joint. I mean, you do start to see structures resemblant of these mechanisms throughout the body when you think about it like a mechanical system. And that's what Still is talking about. And that's why he uses that analogy of blueprints, of engineering. Mechanics are constantly the words that he's using to describe what is actually going on. So, as I alluded to before, I wanted to give a bit of context to the current understanding of science and physiology at the time, so you understand how osteopathy kind of marries the humoralist with the solidist approach. And I'll give you just a very brief kind of synopsis on Rudolf Virchow, who was a physiologist and who we really owe much of the foundational understanding of cellular biology and cellular physiology to. And 1855, with the new technology of using these biconvex microscopes, he's able to really look at cells in detail for the first time. And if you want Virchow in a nutshell, his primary contribution to the field was that by studying the various cells and looking at them in cultures over time, what he could see is that, this hierarchical demonstration from cell to tissue to organ to organ system to human, that this hierarchy of scale that we see in the body is manifest in the microcosm of the cells as well. So that cells don't just come out of nowhere. There's always something that precedes the pathology, the things that turns into a tumor or turns into a various organ system. There's always something there first. They don't just come out of nowhere. They grow and they change, and you see this wonderful dynamic of life, because the cells are not islands. They're bathing in fluid from the extracellular matrix, and that cells indeed have pathways and passageways through the cytoplasm that transmit fluids, that get waste products in and out, that allows the metabolism of the cell to self-regulate and manage itself. And these are all the kinds of things that he was able to observe. Osteopathy, understanding this, Andrew Taylor Still understanding this, was able to observe the effects of mechanical derangement, essentially, on the blood supply. Now, that's the osteopathic way to understand how structure and function relate. But what a lot of the other contemporary minds at the time were doing was essentially going on a naming frenzy. So, now that we understand that, these tumors just don't come out of nowhere, that there's a trace of these malignant cells that turn into something else, that begin to kind of hijack or grow within the body's domain. Now, all these different cancers start to have names. That's what all the other physiologists start to do. They say, well, this is called a Pancoast tumor, and this is called Bright's disease, et cetera, et cetera. They just go on naming things after themselves. And why it's such a unosteopathic concept is because the name has nothing to do with the mechanism. Of course, you're wondering, well, how? What happens that deranges the blood supply that allows these malignant growths to happen, to get a bad copy of a cell which then reproduces? Like what causes that? There has to be like a mechanical cause, a change in the form and function of the body that allows that to happen. But that's not the question that the contemporary minds are really asking. In a way, you can see how it's very much like Still's chalkboard lesson. Someone says it's a pig, but you can see with your eyes it's a turkey. So this is that epistemological question about how do we know what we know? Do we just take experts' words on it? Or do we investigate with our own senses and according to the principles of osteopathy to help solve the problem in nature that the patient is presenting with? So it has to do with observation. And now you see the way that we start within the curriculum of the school, within all the work you do in lab, is that what we're learning to do is how to observe. As we've said, this is 80% of it. 80% of what happens in treatment is having the right diagnosis, making the correct assessment so that you can understand what's going on mechanically. Still use observation all the time, of course. The stories we share about his discoveries in nature, whether it's animal dissection or through scientific experiment. The rule of the artery, this was one of these applied theories that he had to test out, that he had to be certain of in a multitude of different scenarios in order to be sure that it really could be defined as a principle, as a law or state that governs action. He did it with the soldier's thigh. He did it in cases of pneumonia as well. So here's a simple schematic on this. Pretty much says this is the most efficient picture of the mechanism of pneumonia that I could find. There's fluid in the alveoli of the lungs, which prevents the exchange of carbon dioxide and oxygen that needs to happen between the bloodstream before it comes back to the heart to be pumped out to the rest of the systemic circulation. So, do you know what the standard of care was for pneumonia at this point in time? It was actually giving opiates. Now you think about that for a second. The reduced turgor in the blood, the lack of pressure that's then able to flush out the fluid from the alveolus is diminished because it's full of fluid. Now you give someone, for pain management, essentially a sedative, which, of course, you understand is going to slow down the heart and reduce the amount of pressure in the system, which is going to create further stagnation and likely, ultimately, death. So, Still asks the question of pneumonia from a structural point of view. And if we understand that the rule of the artery as a principle, that all healthy tissues must receive appropriate, we could even say neurovascular supply and include lymphatic in there too, then what is in the way of the blood supply and drainage is really the question we ought to ask. And when you look at the structure or the form, it becomes patently obvious. Well, the lungs are housed within the thorax, and that's covered with muscles. And we understand that the intercostal spaces need to be drained. The pleura of the lungs, the fascia that covers the lungs, all needs to be drained appropriately through these spaces. So if there's rigidity, if there's restriction of motion in any of these tissues, it could become a potent cause of the reduction in supply that the lungs are experiencing. And there are many stories about that. But you're probably wondering too, well, but what about nerves, right? Aren't chiropractors talking about the nerves and say, well, every tissue has nerve supply? Well, of course that is true, but every nerve has blood supply, right? If you ever saw Body Worlds, or maybe you've seen these kinds of images, if you can try to imagine the human vascular system down to the very smallest arteriole, you could be looking at that with the naked eye and it would look opaque. You wouldn't even see the spaces with your naked eye between where the capillary beds are and the veins, between the veins and the arteries, or the arterioles and the venules. It would look solid to you. You would have to get a microscope to see down to the micron level to understand that there is actually a tiny, tiny space between it. You think of how dense our blood supply is, how densely packed, it's 100,000 kilometers of blood vessels were you to line them up linearly. Think about that for a second. So again, back to the question of what about the nerves? Yes, nerves are important too. Of course they are. We have some idea of a vasomotor system by about 1840. And there are some kind of rudimentary experiments that they're doing on the effect of sympathetic nerves in rabbits. Claude Bernard does one where they sever a sympathetic nerve to a rabbit, and then they're able to see what happens to vasodilation. And when they do that, they see that a great amount of vasodilation happens, that there's proptosis of the eyes, all the mucous membranes become red because there's too much blood going to them. So they're able to determine that blood vessels are controlled by the sympathetic nervous system, that the caliber of the blood vessels largely are controlled by the sympathetic nervous system. But we still don't really know about the formation. We don't know much embryologically until really even about 1885, understanding that the sympathetic nerves originate in the cord and then ascend up into the head, right? Previous to that, they had dissected these structures and then assumed that, they start in the head and the neck, and then they descend into the rest of the body. So all these things, still would say, phooey, piffle and poppycock, right? What can you do about it? And what he does about it is look at the structure. I mean, even just looking at this image, there are questions that, a child would have, right? Like, why is it shaped like that? What goes through those holes between those different structures, right? And that's exactly what we're talking about through the intervertebral foramen. This is obviously an incredibly important junction of the neurovascular supply, not just the nerve supply, but the blood supply going to and from all the other structures are all passing through here, the intercostal spaces, everything else, ribs, and then you can just layer and layer and layer more anatomy onto that, and to understand how a mechanical problem can have really far-reaching effects. So Still tests out this rule of the artery theory, as I said, all the time. There's a story that happened during the Civil War. He had barely escaped a skirmish, and having done so, had fallen on the pommel of his horse's saddle. And when he got back, narrowly avoiding death, to his camp, he was examined by all the doctors, and he had developed this debilitating heart condition, some arrhythmia or palpitations that would come on spontaneously. And 15 of the other doctors on site looked at him and said, well, I mean, you must have a valve disorder because your heart is behaving erratically. There must be a problem with the valve, we hypothesize. Therefore, you should live a sedentary life and, as they said, live on rock candy and whiskey, right? Meaning don't get too excited and, take these things that will palliate your desire for excitement. Fine. Years later, he's having every so often these arrhythmias, heart palpitations, pseudoangina-like symptoms, something that seems like maybe a heart attack, with all the autonomic symptoms. And, he has this idea that maybe there's something going on with an occlusion to the blood supply to these nerves. And so what he does is he takes a croquet ball, he's playing croquet outside, and he puts it up against the tree, and he's able to sort of press his back and wriggle his back into it. And he hears this loud cavitation, this loud crack, and he's worried for a second that he's fractured a rib. And he gets off the croquet course, and he's able to take a deep breath, and the palpitations never came back. So you think about the mechanism, right? So he falls on the horse's pommel from the saddle. It compresses his sternum, which then has an effect of creating an irritating influence on the blood supply to the nerves of the autonomic nervous system. Now we know we have that sternum that's going from roughly D1 to 7, which of course overlap precisely with the autonomic nerves to the heart that control its rate of its beat and the strength of its contraction. So it makes perfect sense from a structural point of view that once he had relieved the influence on those blood vessels in neurology, that he got an effect, and immediately the symptoms went away. Of course, there was another story as well about what he thought was an obstetrics call, to deliver a baby in the middle of a snowstorm. If he rides on horseback to the call, he gets there, having not brought any of his morphine, any of his sedatives or anything like that, and he finds out that it's not actually an obstetrics call. There was a woman apparently had been hanging a horse, or a pig, in a barn. And the pig, after it had been, to be bled out, fell loose and swung. The hog swung across the room, fell onto her, and winded her, knocked her on the ground. The next day, she developed pneumonia. And so Still was called to the house, and he took the history, listening very carefully, and he asked a question. He said, might I, modestly examine your sternum? Can I have a look at your breastbone to see if there's something going on? And when he looked at the ribs, he was able to see that there was something not right. There was a twist, compression. The ribs were not working properly. And so he was able to correct the rib. And the woman slept well that night. And the next day she coughed up a whole bunch of stuff and recovered from pneumonia, within the next couple of days. No use of sedatives, no use to the common standard of care at that point in time. And of course, his hypothesis, being proven again and again. He says it so simply here. A rib slipped from the transverse process of the spine would cause pressure on the structures of the intervertebral foramen, derange blood and nerve action to intercostal spaces, resulting in venous congestion and inflammation of the pleura, followed by pneumonia in some division of the lung or of the whole pulmonary system. Makes total sense, is so clearly understood how structure and function are related in the osteopathic lesion complex. So, what happened on that day, June 22nd, 1874, when he said he flung to the breeze the banner of osteopathy? Well, first of all, you need to understand, he didn't say that on that day. This was, of course, in retrospect. He wrote in his autobiography, a good 20 years later, 22 years later when that came out, that that was what happened on that day. So as to whether he knew that at the time, hindsight is always 20/20. But what happened was he was talking to one of his older brothers, his older brother James, who was also a doctor, not the one who was the addict after the war, but these were, of course, the brothers that he had apprenticed with his father. And he was talking to his older brother, James. And before I tell you the exact story, I want you to just read what he said about the day, because it's going to frame the whole conversation. This is what he says. I was shot in the dome of reason by an arrow charged with the principles of philosophy. Since that eventful day, I have sacredly remembered and kept its anniversary, sometimes withdrawing from the presence of man to meditate upon the event of that day, wherein I saw that the word of God signified perfection in all things and in all places. Those words, reason, principles, philosophy, again and again and again. This is the vocabulary he uses to describe how he is seeing things. So what happened on this day? Well, understanding that, both him and his brother, James, were both raised as devout Methodists, we need to know that first to understand why and how he uses these words. Now, this was a Sunday morning, and they were having I guess you could say, a theological conversation where Still was thinking out loud. The old doc was thinking out loud to his brother. Remember, at this point in time, he's lost his first family. And medicine at that time was not able to help them. And he's thinking out loud, he's saying, how can it be that God has blessed things like morphine and whiskey and mercury chloride and fly blisters and all these quote-unquote cures that we give ourselves, which are so afflictive. Remember, he'd lost part of his jaw from being given calomel, mercury chloride, when he was a teenager. Poison. How can it be? It doesn't make any sense. It's not a reasonable proposition to think that these are things that in the wisdom of nature or God that we should be taking. And that's why he uses that vocabulary. He then goes on to say that it must be the only logical or reasonable assumption if man is created in God's image and we are imperfect, and we give ourselves imperfect cures, then the only syllogism that would be reasonable to assume was that God is imperfect. Now, this is a dangerous idea to be suggesting in this climate, especially to his brother, a devout Methodist. And his brother says to him, his brother James says to him, "Stop talking now, for I fear you will soon be lost." And still continues on this vein. His brother leaves. He excommunicates him, believing that he's been possessed, and doesn't talk to him for almost 20 years. So the conviction of Still's belief had to do with, obviously in retrospect, the resolution that he found, as he says, wherein I saw that the word God signified perfection in all things and places. So this was obviously the course of reasoning that happened likely in those many almost 20 years after that conversation, which was, well, we must be, that can't be the case. We must be created in a perfect image of nature. Therefore, it must be that we have within us all the cures, or as he said in that previous quotation, all conveniences for which it was created. It must be that we contain, that the material body contains the elements of medicine that we need within us, if the form and the function, if osteon and pathos align. This idea was entirely ahead of its time. So much so that, everywhere he went, this, as they called him the bone doctor at one period of time, he was met with sideways glances, people asking their kids not to, be friends with his children. Across the street, if you see that old strange man coming your way, he apparently has bones in his pockets, right? And we know he would, have the carpal bones or something like that in his pockets. He'd be memorizing the shape of them. Things are not easy with this idea now. He'll move to Kirksville eventually. They're in Kansas at this point in time. They'll move to Kirksville by about 1875. These ideas make it difficult to practice medicine in a way. He does start eventually giving placebo to patients, but he's still prescribing drugs until 1885, and I'll tell you the story about that. His wife Mary is selling magazine subscriptions to make ends meet. He does get typhoid, and I think for 9 months or so, he can't practice, has a series of strange dreams that he writes about in his autobiography. He has no glimmer in his mind that he's going to start a school, the American School of Osteopathy, in 1892. But it's a long time of amazing perseverance he has to go through to get to the man that we later understand that becomes the discoverer of this philosophy. But as I alluded to before, he's very much ahead of his time. He's ahead of his time in this way. This is a picture of the mechanism of the opioid receptor, which we understand is this GABAergic interneuron, which is an inhibitory interneuron. So it acts on pain signals, right? It gets in the way of that free nerve endings conduction, and is able to interrupt the pain signal, essentially at the spinal cord. Now, here's the interesting thing. This word endorphin. Well, endorphins were discovered after the opioid receptor was. The opioid receptor this is from the 1960s is when they actually understood that there was a receptor that acts on it. But what we see is that word endorphin, the runner's high, essentially a supraspinal control of pain, it comes from the brain, is a portmanteau word of endogenous, meaning comes from inside, and morphine. So I share that story because what it tells you is that they knew of morphine before they knew of endorphins. Endorphins were named after the exogenous, or that synthetic form of endogenous morphine, the exogenous morphine, I guess you could think about it. So they knew about the drug before they knew about the mechanism. And the reason why we have a receptor that drug works on is because we create endorphins, because we make something that is chemically similar to morphine in our brains, and then we're able to deliver it to inhibit pain. This is precisely the inner pharmacopoeia that Still is talking about. He's just, about 100 years too early for anyone to listen to him. They think he's out of his mind.